Hi, this is Michelle Thomas. I am in Palm Harbor, Florida at Revitalize Health Solutions, and I'm here to do our second installment on mold toxicity. We talked yesterday about how to prevent getting mold, and today we're going to talk about a little bit about how you get mold and who gets mold. We'll continue on with our series going forward about the diagnosis and the treatment of mold, but today I just want to focus on who gets it and where you get it from. So when people feel sick from mold, they often don't realize that it's mold that they are feeling sick from. They can get it from a dorm room at college, they can get it from home, they could get it from a hotel or their workplace that's been a water damaged building or hotel maybe on vacation. There's a lot of different sources or places that people can have mold exposure. So in the beginning, they may go to their primary care and often be misdiagnosed or overdiagnosed. Some of the symptoms that people go to their providers and complain of are congestion, they have sinus infections, they are developing these asthma symptoms, they're having extreme fatigue, insomnia, or they're having some strange mood changes, unanticipated anxiety, or even feelings of depression, exhaustion. All these things in and of themselves can be independent symptoms, but together they can be classified as a mold syndrome. So how we know about this is the physician that we want to credit with the studies and the naming of mycotoxin exposure, mycotoxin poisoning is Dr. Shoemaker, as we all know. He has termed it chronic inflammatory respiratory syndrome, or CIRS for short. He has been working on this for about 30 years, and now we have a biotoxin illness or bundle of symptoms that can be clinically diagnosed. There are labs that can be drawn, but most traditional medical providers are not trained in this, and they will not know to draw these specific set of labs. Again, there are a couple of ways, there's multiple ways that we can get exposure to mold, to biotoxins, and I'm just going to tell you a little bit about each one. Inhalation is the first one. So inhalation of the mycotoxin spores. So being in a building that has mold in their ventilation system, air conditioning system, heating system, you're in an office every day and the mold spores are blowing out at you and you are unaware that you are inhaling these organic compounds, and they can make you sick. The next one is by ingestion of food. So you are eating a reef fish that's contaminated. You're eating some sort of fish that has this reef contamination of biotoxins, and you become ill that way. The other thing is contact with contaminated water. So you're swimming, you're drinking, you accidentally inhale water, and the aerosol particles go into your lungs, and you are now biotoxin poison. The last category people don't necessarily think of, because it's not necessarily mold, but it is a biotoxin, is a tick or recluse spider bite. And so people may not remember being bitten by a tick, they may not have a diagnosis of Lyme disease, but they do create biotoxins, and people will remember getting bitten by a spider, but they may not necessarily be aware that they did have a tick bite, or that the tick bite gave them this syndrome of the biotoxin. So those are the ways that you are exposed to biotoxins. But the question is, and I get this question a lot, why does everybody not get sick? So if everybody's in a building that has water damage, if everybody's been on the same vacation and they've eaten the same food, if everybody has inhaled the mold spores from a home that they live in, why isn't everybody sick? And I'm going to answer that question right now. So before I do that, I want to just go over really quick. If you or somebody that you have been in contact with is feeling sick and doesn't know why, they've been to the doctor and they've been brushed off and told that they probably have fibromyalgia, or they have anxiety or depression that has come out of nowhere, PTSD or allergies that just won't go away, you may want to look a little further into getting some specific labs done or testing done for mycotoxin exposure. So who gets it and why does everybody not get sick is the next thing that I want to talk about. So a couple of very simple things about your immune system. Your immune system has little, we call it guards. It's your innate immune system, and they are guards that look around for something to be in your system that does not belong there. When your call them general guards, when your general guards detect something in your system, they start firing off alarm signals. And what they're firing off alarm signals is to awaken the special forces. So we call them the special forces of the immune system. And this is the adaptive immune system. These special forces are to go directly to the site of an attack. And so everybody has human leukocyte antigens. They are specific genetic traits on the 6th chromosome that everybody has. There is in 24% of the people, they have an HLA or human leukocyte antigen defect on that chromosome, and those special forces, which are the specific adaptive guards in the immune system, do not recognize or do not know what to do when there is mold toxicity in the body, so they do not respond. And so I'll give you, I made a little chart, and so I want to go over that chart. So this is the difference between how some people in the same household or in the same building or on the same vacation get sick and others don't. So as you see right here, this is where you get exposed to the toxin. So you're exposed right here, everybody is exposed. This is in a non-susceptible person. So this is in a person that does not have that genetic defect. So they're exposed to the mold, their innate immune system, that sounds the alarm. So those are the general little guards. The alarm goes off, and what happens? The adaptive immune system, the special forces, they go and they eat up the mold and they detoxify it, and the body goes out, gets rid of the mycotoxins. The people that are susceptible, that have this genetic defect, they have that same exposure, and the general guards start sounding off the alarms. What happens? The special forces are still sleeping and they don't wake up to go get the mold. So the general guards start sounding the alarms more and more and more. Special forces don't respond. What happens in the body? There becomes an inflammation in every organ, or just in some organs, but the inflammatory processes from those guards take over, and there you have a chronic inflammatory respiratory syndrome. So it often starts in the respiratory tract, again, like I said, with the sinus infections, with asthma, with inflammation to the brain, which can cause anxiety or depression. And yes, it can only be in 24% of the population. You have a family of 6. I've had this before where I'll have 2 people in the family become very, very sick, and the other 4 are perfectly fine. They don't have any symptoms. And this is the reason why those other 4 people did not have that genetic defect on that 6th chromosome. So that's what I want to cover today. Just if anybody has any questions or concerns that they have had a mold or a mycotoxin or a biotoxin exposure, reach out to us at Revitalize Health Solutions and we can get you evaluated. Be well.